we help them try to clarify what their goals are, what's important to them, in their life.
Welcome to Better Together podcast, produced and directed by our Hospice of South Central Indiana, a not-for-profit organization dedicated to making every moment count. We will share true stories about hospice, palliative, and personal care services that we provide in 22 counties all over South Central Indiana. I'm your host and president, Steph Cain. Today I have with me Donna Butler, and Donna is a nurse practitioner in our palliative care clinic. Welcome, Donna.
Thank you for having me.
Well, I'm excited for our audience to learn a little more about palliative care. And I just wonder if you can share a little bit about your journey, your background, how you came to serve our community in palliative care services.
Okay. So I had many years as a nurse in home care and in cancer care. And so I saw a lot of patients who had chronic health problems and symptoms that needed to be managed. And so years later, when I was looking for advancing my career, I looked into palliative care services, which was kind of up and coming and sounded like a wonderful opportunity to provide the care to the patients that they needed.
Perfect. So. There's a confusion, at least for me. And I think many in our audience are wondering, what's the difference between palliative and hospice care?
Yeah, a lot of people combine hospice and palliative care as the same thing. And truly palliative care and hospice both provide pain and symptom management. So hospice care, though, is more provided for patients with a terminal illness who are no longer looking for curative care, or they choose not to pursue additional treatment because they're having too many side effects, or the side effects outweigh their treatment or their benefit. With palliative care, we begin anytime after a patient's been diagnosed with a serious illness. So they can even be seeking curative intent for their disease.
Can I ask a question here? So if, let's just use cancer as a diagnosis.
Right.
And I know many listeners are, have this experience with cancer. Maybe it's a loved one or maybe a neighbor. And so would they connect with their oncologist? Would they ask their oncologist if maybe they're ready for palliative care, or would they directly contact our clinic? How does a person get connected with palliative care?
Okay. They can do either. They can have their oncologist refer them because they're having symptoms that are interfering with their quality of life. They can also call our office themselves and make a self-referral. The only thing that we look at with self-referrals is some insurance companies require a formal referral from another provider. So we typically say, talk to your oncologist or talk to your family doctor to make that referral, just to make it easier for the patients as far as from an insurance standpoint.
So I know our clinic is in the hospital, Columbus Regional Hospital, and across the hallway from the oncology clinic.
Yes.
And so with our patients learning of their diagnosis and treatment plan, and then seeking, palliative to go alongside that treatment plan, what would they experience from our palliative clinic that would be helpful while they're receiving maybe their chemo treatment or whatever their care plan is with their oncologist?
Right. So again, palliative care walks beside the patient and their family. We don't replace any of their specialists or their primary care provider. We focus on the patient's quality of life, their physical symptoms, emotional symptoms, social issues, spiritual symptoms that they might be experiencing due to their cancer or serious illness. Or also just, the treatments that they're experiencing. They may experience some symptoms that are interfering with their quality of life. So we walk side by side with them, helping them with those symptoms, helping them with understanding their disease and helping them manage their disease, and a lot of care coordination. We work really closely with the oncology clinic. We also work very closely with the other specialty clinics so that patients, if we see something, we can communicate with their oncologist and vice versa. So it's very close relationship, and I feel like we really do a lot of support for the patients and their families, helping them navigate all these strange waters that they're going through.
So can they call our palliative care team throughout the day for questions? Are there certain office hours you hold, or how does all that work that they have?
Right. So our clinic is open Monday through Friday. People can call from 8 to 4. And speak to one of our team members, either our nurse or medical assistant. They may even speak directly to one of the nurse practitioners based on what's going on with the patient. And so that's their way of contacting us.
That's wonderful to be able to just call and have a nurse practitioner answer the phone and ask your question about your medication or maybe a symptom that you're having is powerful. It's really a gift. I'm wondering, could you share a story about a patient, just a real life story that, having palliative care alongside their curative care and the benefits of it, what that looks like for them?
So I, early on in my career as a nurse practitioner, I had this wonderful patient that he really brought home palliative care to me. He was about 75 years old. He was a professional, or had been a professional, and had been diagnosed with prostate cancer that had spread to his bone. And he and his wife, he was 75, they were still out and about doing things. And so he was very involved in the community. They were traveling still. And boy, oh boy, he hit this brick wall with this cancer diagnosis, because it not only, affected him physically because of the bone pain and things he was experiencing. It changed his life as far as being able to be active and just even thinking about what does my life look like now?
Right.
So it really affected his relationship with his wife, too. And so he came to our clinic, and he was in a wheelchair because his pain was so bad. So we got to work really quickly on getting his pain under control. He also was having a lot of problems with sleep problems and anxiety and depression. So we worked really closely with him on adjusting medications. We had a social worker and a therapist that worked with him, just helping him, guiding him as far as counseling and working on coping skills and just how to deal with all of these new things that were going on in his life. The other big thing he had was hot flashes. With the cancer treatment, it caused him severe hot flashes. And so trying to get those symptoms under control with some medications. And, the oncologists started their treatments, for his cancer and things. And our social worker was working with him. Our chaplain met with him and his wife many times and helped them from a spiritual standpoint. Once he started getting his treatments and the medicines were helping with symptom control and things, he was starting to get his life back. And one day we got a letter in the mail from him. And he was just so appreciative and so pleased with how he had gotten his life back. And we followed him for a number of years, and he ended up having a progression of his disease, several years later, and ended up transitioning to hospice care. And but we followed him for a long time with managing his symptoms and working with him. So it was a great experience just seeing what a difference palliative care can make.
That's beautiful. It's really the new normal, and
exactly.
It's a bridge to help us, really connect from here's who I was and this is what my life looks like now, and making every moment count. Each moment of the way.
Absolutely.
So, great stuff. For patients or families considering palliative care, what should they know?
To know that we meet them where they're at. Okay. That's one of our little sayings, I think, over in palliative care, that we just meet them where they're at. And sometimes patients aren't in the same place that their families are. So we meet them where they're at.
Yeah.
we do frequently look at what their symptoms are. Our focus is on their quality of life, how their physical symptoms, emotional symptoms, spiritual things, social things are impacting their quality of life. We know that the specialists like the oncologists and others are working on treating that serious illness, but we're there to really support the patient and the family as a unit. So we help the patient and family understand their disease and what the treatments are looking like. We help them try to clarify what their goals are, what's important to them, in their life. Also helping them with, sometimes there's some tough decisions to be made about their goals and moving forward or not moving forward with certain treatments based on what the benefits are versus the risks. So, and just what's really important to the patient, their hopes, their worries, those type of things.
So good. Our palliative care program is unique. I think we are caring for, at any given time, about 250 patients and community members, their extended loved ones and family members. So what would you say is unique about our palliative care?
I think our team is unique, number one. We have an awesome team. The other thing that I think is very unique is a lot of times palliative care is not a big money maker. So so it's, there's a lot of cost involved that's not covered under insurance plans and those type of things. And we're very blessed here that we have financial gifts that help support. And so we are so appreciative and so thankful for the donors who give to the program so that we are able to provide those care services to the patients and their families.
It's beautiful. Thank you, Donna, for joining us. This is Better Together, a podcast dedicated to making every moment count. Thank you for listening. Please like us and share on your social media channels. If you have a question and would like to learn more about a specific topic, you can find us at www.ourhospice.org or call 812-314-8083. Until next time, remember, life is short. We are better together, making every single moment count.